Hi, good day. I am Matri Mariam Dakula San and welcome to Core 15 Physical and Health Education. So for today we will be discussing about the risk of diseases with the use of prohibited drugs. But before jumping into our topic, let us first discuss drug addiction. Drug addiction is also called substance use or use disorder. It is a disease that affects a person's brain and behavior and leads to an inability to control the use of a legal or illegal drug medication. Substances such as alcohol, marijuana, nicotine are also considered drugs. When you're addicted, you may continue using drugs despite of harm it causes you. The risk of addiction and how fast you become addicted varies by drug. Some drugs such as opioid painkillers have higher risk and cause addiction more quickly than others. As time passes, you may need larger doses of the drug to get high. Soon you may need the drug just to feel good. As your drug uses increases, you may find that it's increasingly difficult to go out without the drug. Attempts to stop the drug may cause intense cravings and make you feel physically ill. This is called the withdrawal symptoms. Addiction is a disease that affects your brain and behavior. When you are addicted to drugs, you can't resist the urge to use them, no matter how the drugs harm you much. The earlier you get treatment for the drug addiction, the more likely you are avoid some of more consequences caused by these drugs. Drug addiction isn't just about heroin, cocaine, illegal drugs. You can also be addicted to alcohol, sleep, sleep, anti-anxiety medications, and other legal substances. At first, you may choose to take the drug because you like the way it makes you feel. You may think you can control it, you can control how much you often use it, but over time, drugs change how your brain works. These physical changes can last a long time. They make you lose control and can lead to damaging the behaviors. And now let's proceed to the symptoms. There are several symptoms of addiction or behaviors. This includes feeling that the person have to use drug regularly, daily, or even several times a day. Having intense urges for the drug that block out any other thoughts. Over time, needing more of the drugs to get the same effect. Taking larger amounts of the drug over a longer period of time than you intended. Making certain that you maintain a supply of the drug. Spending money on the drug even though you can't afford it. Not meeting obligations and work responsibilities or cutting back on social or recreational activities because of drug use. Continuing to use the drugs even though you know it causing problems in your life or causing you physically or psychological harm. Now let's proceed. Mhm. The risk. We are now at the risk of taking the drugs. The effects and dangers of drugs are influenced by many things. Personal factors involving the person who is using the drugs can be just as important as the drugs being used. If they have physical health problems like heart disease, high blood pressure, epilepsy, diabetes, asthma, or liver problems, drug use could be more dangerous and possibly make their health problem worse. The drug user's energy levels at the time of consuming drugs can also be important. If they are tired at the time of use, then it may have different or more extreme effect than if they are fresh and full of energy. If the users have a low body weight, the same amount of drugs may affect them more than heavier people. Also, people who have eating disorders like anorexia and bulimia can find the drug use makes their eating difficulties even worse. The drug experience and expectations of the users are important. Many young people experimenting with drugs for the first time will be unsure about what to do or what to expect. This ignorance and lack of experience can be itself dangerous. Males and females can experience drugs in different ways. This is both because of their different physical makeup and the different way people make view of male and female drug use. On over an average, women are smaller body weight than men, have smaller livers as proportion of body weight and greater proportion of body fat. This means that generally speaking, the same amount of drugs will have greater effect on women than on a man. Have Obviously this will not apply with much larger than average women or much smaller than average men. Now let's proceed to the risk for the mental health. Studies show that drug use can increase the risk on mental health issues such as anxiety, depression, or psychosis. People with mental health issues also have higher risk of drug use problems. The mental psychological state of the drug user is very important. The mood people are in when they take drugs influences the effects and dangers of drug use. If they are anxious, depressed, or unstable, they are more likely to have disturbing experiences when they are using drugs. They can become more anxious and disorientated, possibly aggressive or freak out and do some crazy things or take out too much or etc. As a general rule, someone who is happy and stable is more likely to use more carefully and not so badly affected. And there are also risks in a relationship when it comes to using prohibited drugs because drugs can change your behavior. They can affect your relationship with family and friends. There is an increased risk of injury and or assault to both yourself and other people. When you are using drugs, the tendency to hurt people around you is high. People who tend to use drugs hurt people around them. They became violent where in fact they are not that violent before using drugs. Let's proceed. There are actually different types of drugs. First is the crack cocaine. Crack cocaine, also known as crack rocks, is the purest form of cocaine available and is smoked through a glass pipe. It causes users' brain to release large amount of dopamine, which results in intense feelings of pleasure and burst of energy for about 10 minutes. Some users become addicted to crack in the first time they try it. Crack cocaine and powder cocaine have similar chemical compositions and effects, but crack causes stronger, faster high, the one that lasts for shorter amount of time. Crack abuse became national crisis in the 1980s or early 90s, although crack users make up just a small percentage of overall cocaine users today. Next is the heroin. Heroin users instantly get a rush and after a time cannot experience any good feelings without using it. It addicts gets intense cravings while going through withdrawal. Heroin is a semi-synthetic substance that is extracted from the opium plant, making it a member of the opioid class of drugs or the painkillers. Heroin is generally taken by a needle injection, although pure forms of the drug can be smoked or snorted. Heroin's addictive properties that I have discussed with the first item on the list, as more uses of the drugs literally causes the brain to crave it. Many heroin users got their start by being prescribed a legal opioid painkiller. I've said it earlier. These drugs are closely to the painkillers. Painkiller, and then they crave similar, likely stronger effect once the prescription ran out. First, you were using the drugs to get rid of the pain, but then later on, you will be using it to feel good. Then third is the methamphetamine. The methamphetamine affects dopamine and norepinephrine levels in the brain, making the user alert and hyperactive. Meth releases massive amounts of dopamine into the brain, suppresses norepinephrine production. Users develop a tolerance quickly and develop cravings for more of the substance. Methamphetamine can be smoked, snorted, or taken orally. It can also be dissolved in a water or alcohol and then be injected. Crystal meth is one of the most common forms of the drugs and is often considered the club drug. Meth usually suppresses the user's appetite and high doesn't wear off for 6 to 8 hours. Long-term meth use can cause memory loss, psychotic behavior, heart and brain damage, dangerous weight loss, and tooth decay or gum recessions. Now let's proceed to the fourth type of drug, the bath salts. Bath salts are synthetic type of drug that create the effects. Bath salts synthetic type drugs that create a feeling of euphoria and are taken by injecting, snorting, or smoking the substance. The effects can last for several hours, but users often redose and make up for several days. One of the main substances in bath salts, the MDPV, was found to be nearly addictive as methamphetamine. Bath salts are considered a cheap alternative to cocaine, ecstasy, or methamphetamine. As a stimulant, bath salts reached a high usage in the mid to late 2000s, began cracking down the substance in 2012. Bath salts often cause insomnia, agitation, hallucinations, and even violent behaviors upon first use. Long-term can lead to kidney and liver damage as well as breakdown of skeletal muscle tissues. Now next is the cocaine. Cocaine, like many other drugs on this list, affects amount of dopamine in a person's brain and cause intense cravings for more substance. Snorting cocaine powder causes a rapid, intense high and builds up tolerance quickly. Coming down from a cocaine high can cause depression, edginess, and irregular sleeping eating patterns. Cocaine use also carries the risk of heart attack, stroke, seizure, and respiratory failure. Long-term can lead to psychosis and hallucinations. Every month, somewhere between 1 million and 2 million actually were Americans typically that uses cocaine. And then let's proceed to amphetamines. Amphetamines, not to be confused with methamphetamine, amphetamines or uppers create a rapid tolerance and intense cravings in users. They make users feel confident, energetic, euphoric, and they may be attractive for their appetite curbing traits. Amphetamines are usually taken orally but can snorted or injected also. This substance is featured in some legal drugs such as Adderall and Dexedrine, although several street forms are also available. Amphetamines side effects include anxiety, nervousness, dry mouth, decreased appetites, headaches, weight loss, and long-term use of amphetamine can lead to panic attacks, psychotic episodes, acne or skin conditions, and convulsions. Now let's proceed to methadone. Methadone is an opioid that is commonly prescribed to treat heroin or morphine addicts, as this pain reliever helps the user calm down from those harder substances. Even though the risk of addiction is low when used as directed by doctor in a clinical setting, many recreational users have been drawn to the substance and subsequently become addicted. Methadone generally comes from the same effects as morphine but not quite strong or addictive as that opiate. Methadone can slow or stop users' breathing, especially when someone first start using the drug. Other short-term effects of methadone include itchiness, severe sweating, constipation, nausea or sexual dysfunction, and even death. Next is the benzodiazepines. The downers like Xanax, Valium, and Clonopin makes users feel calm and relaxed by increasing the brain's nerve calming agent called GABA. It's hard to get off this drug once tolerance starts to build up, which can take place very quickly. More than 15 types of benzodiazepines, aka benzos, are legal types of drugs available via prescription, although illegal kinds of substance are traded on the black market as well. Benzodiazepines are considered as minor tranquilizers, and they affect the user in short term with side effects such as impaired cognition, lethargy, depression, altered vision, impaired motor functions, tremors, nausea, abdominal pain. Long-term use of benzos can cause brain damage, and withdrawal symptoms includes body aches, muscle stiffness, sleep disturbance, anxiety, seizures, irritability, and memory problems. Now let's proceed to the ninth one, which is the ecstasy. Ecstasy is the most popular type of club drugs. Ecstasy, or the love drug, was commonly used in the 1980s and is still part of the club scene. Users feel happy, loving, alert, and focused, yet very relaxed when under its influence. Some users can also do without sleep for between 24 to 72 hours at a time. Ecstasy, also known as E or X, is an admitting that they would have trouble quitting it once they are using. Ecstasy's active ingredient, which is the MDMA, which is now popular in its pure form known as Molly. Ecstasy and Molly are commonly available as a capsule, tablet, or powder. Ecstasy's side effects include muscle cramps, blurred vision, increased heart rate, nausea, chills, and hallucinations. Someone who's become addicted and experiences withdrawal symptoms may experience panic attacks, insomnia, psychosis, depressions, and paranoia. And lastly, the marijuana. Although marijuana is the most benign type of drugs on this list, it is certainly can cause changes in the brains to the point of addiction. Marijuana isn't seen as being physically or chemically addictive, but many health experts agree that it can be psychologically addictive. Roughly 10% of people use marijuana will become dependent on it, according to the National Institute of Drug Abuse. Marijuana as the most commonly illicit substance, marijuana is now legal in some states in the US and is available in many other via prescription. Marijuana addictions can lead to mild withdrawal symptoms such as irritability, sleep difficulties, restlessness, physical discomfort, and decreased appetite. Long-term use of marijuana has been found to decrease the volume of gray matter in the brain, while a longitudinal study in New Zealand found that teens who started and continued using the drug regularly lost an average of 8 IQ points by mid adulthood. And that's it. That's all for my lessons, and I hope you have learned something from it. Thank you for listening. Again, I am Metoy Mariam the Kulason. See you!